Hi, everyone. This is Justine, CEO of ARCH Collaborative. I wanted to share a little bit more about our mission, our work, and future directions. So today we'll first talk about kind of how ARCH was founded, our mission, vision, and values, our work thus far, and where we're hoping to go. So first is, why does ARCH Collaborative exist? So to provide context, here is a very cute map of Los Angeles, and circled is East LA, which is where I go to school. And I was fortunate to attend medical school at a place where I had a lot of support from mentors in public health and community-based approaches. And I also did the vast majority of my clinical training at LA General Medical Center, which is the largest safety net provider in Los Angeles County. And so what I felt as I was going through volunteering, research, and my clinical work is that we really are not doing enough in the communities to reinvest in them and to prepare them for what I feel are the greatest problems of our time, chronic disease and climate change. And one of the things I want to convey with this presentation is that the burden of chronic disease and extreme weather are rising at the same time, and that these are in fact related issues with related solutions. So here is some data to back up everything I'm saying. So first is on the left from the European Environment Agency. So what we have seen from 1990 to 2010 is that the rate of non-communicable diseases, so things like heart disease, high blood pressure, cancer, diabetes, have been increasing by 10% in terms of global health burden. And then on the right, this is from the 6th IPCC report. We're also seeing that the percent of land area affected by extreme temperatures over the exact same time period has seen a 10% increase as well. And so the next question is, why is this? And I would argue that we have shared global drivers of both NCDs and extreme weather. So when we look at our food systems, when we look at increasing urbanization, changes in transportation patterns, and increasing globalization and technology, all of these things have brought about immense progress, but they've also increased our greenhouse gas emissions, and they have promoted certain societal changes and lifestyles that contribute to non-communicable diseases. And then importantly, besides the causes, the effects are also disproportionately on people who live with chronic diseases. And so one of the projects that I worked on before starting ARCH Collaborative was doing NCD research in Kenya right after COVID-19. And so that work looked at the perceptions of patients with diabetes, as well as providers who treated these patients, and how were they affected during the pandemic. And one of the biggest things that we saw were that gaps in care really increased the number of complications from diabetes that we saw across the country. And so because of the fact that chronic diseases often require continuous specialized care, we need to be prepared. And there are a number of solutions that we can implement so that we can minimize disruptions in care during extreme weather, during global pandemics and other economic and social disruptions. And then second, extreme weather can directly cause disease complications. So we have good research now showing that extreme heat can increase rates of heart attacks. And a very simple example is that after wildfires, when air quality becomes very poor, that can precipitate asthma attacks as well. And then finally, we also have to consider people's baseline health reserve. So folks who are living with chronic diseases may have less capacity to bounce back from physical stressors. And then on top of that, there's also an aspect of what we can do on a systems level, with like one example that comes to mind being Hurricane Katrina, where our systems were not prepared to take in large amounts of people to shelters, and we didn't have good systems in place to protect them from things like extreme temperatures, dehydration, and malnutrition. So that's another area where we do have solutions, we just have to implement them. And so the question that I asked is, what are we missing? When I look at, being at the largest safety net hospital in LA County and seeing so many patients coming in with late stage preventable complications of chronic diseases, and being in the community where in the middle photo, this is at a Lunar New Year festival, which was actually really fun. And we were doing community outreach. And so this is me, and this is my partner, Arthur Bookstein, who is our Chief Operating Officer. And then finally on the right, this is a photo from Tropical Storm Hillary, and you can see that there are people wading through this muddy water, and there's probably difficulty with the vehicles being able to get through, and so they have to kind of take out their belongings and walk through. And so this is another area where our infrastructure can be better prepared to deal with our changing weather. And climate adaptation is a reality that we have to face at this point. And so the goal of ARCH Collaborative is to align what is happening in our clinics with what is happening in our communities and what is happening in our climate. And so just in terms of our actual founding timeline, so some of the first things that we did were discuss with existing organizations on climate and health, also doing our own background research on what initiatives already exist to advance community resilience against extreme weather. And I will say that what we found is that, prior to the Palisades and Eaton wildfires, the idea of disaster preparedness and its link to health was not a very popular topic and not something that organizations were really looking towards. And so we filed our articles of incorporation in August 2024, and we got our 501c3 status in October of the same year. And so I would be remiss if I didn't talk a little bit more about the wildfires. And so I wanted to just provide some context here in terms of climate, because there's been a lot of media coverage over the wildfires. However, I don't think there's enough emphasis on how this is not an isolated event. This is, in fact, a buildup from years of multiple extreme weather events, and that we can anticipate and prepare for these types of events. So 2 years before the wildfires, we had unusually heavy rainfall for 2 seasons in a row. And this included Tropical Storm Hillary, which was advertised as a once-in-a-lifetime storm. Now, the problem is that with increasing greenhouse gas emissions, we're seeing that these once-in-a-lifetime extreme weather events are no longer once in a lifetime, and they're happening more and more frequently and compounding on one another. So just an example of this is that after we had 2 years of very heavy rain, we then had very dry and hot conditions. And so in 2024, we had a record-breaking heat wave. And this basically created perfect conditions for wildfires because we had a bunch of vegetation, and then now it's drying out because of all of this extreme heat. And then the cherry on top were these hurricane force winds. So on January 7th, we had Santa Ana winds that were at the 99th percentile compared to historic data. And so that is just the precipitating factor for all of this fuel across Los Angeles to basically implode with wildfires. And then also to touch upon the solution. So, there are things that we can do. And so one of the things that ARCH did is we partnered with the Norris Cancer Center. And what we did is we provided multilingual educational resources. And what I was told by Norris is that there were a lot of questions from patients. They didn't know what to do. And it is a very challenging and scary time. And so what we did is put together these materials. And so while we are not perfect and we're always trying to get better, at the very least for these ones, we were able to do English, Spanish, and Mandarin. And then we also did have some materials as well in Tagalog. So now going on to our mission, vision, and values. So our mission is to advance innovative, evidence-based solutions that build community resilience against chronic disease and extreme weather. And in terms of our vision, so the first thing that I want to highlight is the idea of multi-sectoral partnerships. So this is something that in my research outside of ARCH, I've found to be very effective at improving clinical outcomes beyond standard of care. And so importantly, we highlight here community is always first, community is always centered. And our theory of change is that we have a cycle where we have research feeding into education, education feeding into action, and vice versa. And so ideally, what this leads to first is engaging the community, developing an idea of shared understanding, developing our partnerships, and ultimately reaching our outcome of community resilience, which is what we really want so that we can improve clinical outcomes and that people can be safer during extreme weather events. And so these are our values. So just briefly, common humanity, mutual respect, integrity, excellence, and continuous improvement. And I also wanted to talk about community-based participatory approaches because that is something that's very much at the center of ARCH. So we always want to be partnering with community leaders. We want to be asking about community needs and tailoring our programming towards those needs. And so an example of that is with the heat waves that we had just last week. We have our community climate adaptation program. And so we were able to deliver our extreme heat supply kits to the USC street medicine team in a timely manner. And then related to that, centering our work in what is happening on the ground and also providing opportunities for community members to grow and share their expertise. And so that is one of the events that's coming up soon, which are with our ARCH Scholars Roundtables. And so now let's talk about our work. So yes, so here again, this is our theory of change. And so we'll focus on research, education, and action. So in terms of our research, since our founding 1 year ago, we published an abstract at the World Cancer Congress. This was on the impact and opportunity of community health programs to meet supportive oncology needs in refugee camps. And so part of my background before starting ARCH was around human rights in medicine, which is still something that I think is very much related to our work and very important. And this is a very low resource setting oftentimes, and I feel that we're really not even thinking about how we are supporting people with chronic diseases in these settings. And community health programs, such as those that we've seen in Partners in Health, which has amazing clinical outcomes, can really make a difference at a very low cost, especially when it comes to supportive oncology, where we have a lot of psychosocial work in managing complications and late-stage effects. And we already know that things like client navigator programs are very effective at improving outcomes in these patients. And so we can apply that in this setting at a very low cost. And then second, we published in the Public Library of Science, Global Public Health. So this was a systematic review, and this was on community-based solutions for chronic disease management during natural disasters. And the reason why we published this is actually because we wanted to inform our own work, and one of our upcoming events with the roundtables, the work that we did with this systematic review is going to be very helpful for our workshops that we're doing on what has previously been done and what has been effective for community-based solutions. And then finally, we did an abstract at the annual Society of Clinical Oncology annual meeting, and that was on drivers of delayed care among cancer survivors. And this actually won a Conquer Cancer Foundation Merit Award. And so part of this is also something that eventually I'd like to see feed into our programming, because what we saw is that at different life stages, the kind of support they need to access care is different. So, for example, transportation access is much bigger of an issue when you're younger. Childcare support becomes something that's more important as you're entering middle years. And then at older ages, your needs are also different in terms of the kind of support that you need. And so we can tailor things a little bit better. And then this is our education work. This is not all of it, but this is a lot of it. So as mentioned, language accessibility is really important, and we're still not perfect, but we are always trying to improve. And so for these, we have it in English and Spanish. We did a nasal spray guide. So this is really helpful for patients to do as self-care during times when air quality is poor. So after a wildfire, maybe you're not in an area directly affected, but you're receiving smoke from the fires. So this is something that you can do at home. And then we also have infographics for what to do before a heat wave and what to do during a heat wave. And then, as mentioned previously, we did also partner with North, and so we have educational materials for after the wildfires back in January. Okay, and then here is some of the action that we have taken, and so I love seeing these photos. So we had our amazing volunteers do fundraising at the LA Times Festival of Books. We've also done a lot of bonding within our own organization. So this was just a potluck that we did, and we got insomnia cookies. And then, as mentioned, kind of relating education to action. So these are the same like heat wave infographics, and so we always are trying to support our local suppliers. And so this is with an indie printing company, and so we tried to, or not tried, and so we printed it on recycled paper, which was really nice, but there's still also a lot of opportunity for improvement. So for this, we did use new drawstring bags and reusable water bottles, and it's always better sustainability wise to go secondhand first. But it just so happened that at this time we had received some donations of Amazon gift cards, and so we used what we were given. But in the future, what I'd like to see is kind of living those values of more secondhand first, especially when we think about, for example, with water bottles, there's so many good quality water bottles that are just sitting around in our thrift stores around this entire city. And so this was through our community climate adaptation program. As mentioned, just last week, we had a heat wave in Los Angeles, and so we were able to donate all of these kits to USC Street Medicine, which is an amazing program as well. We also received a pilot grant, which is going to be fantastic in terms of being able to reinvest that money back into the community. And we'll talk a little bit more about that in our future directions. And then we have a partnership with LA City Council, specifically Council District 1. And so we participated in their budget roundtable, which was very eye-opening for me as we are facing a deficit and thinking about how important it is for us as a community to be organized and to advocate to prevent very important programs from being cut, such as things like our parks, things like community safety and youth development. These are all things that can be cut if we do not fight for them. And this is from our meeting at City Hall as well. So let's talk about future directions. So the first is coming up very soon. So September 20th, Saturday, 10 to 12 p.m., we have our inaugural ARCH Scholars Roundtable. And so kind of as I was alluding to with the NIH grant, we have $10,000. It's actually a little bit more than that, that we want to just directly invest back into the community, specifically in MacArthur Park, which has a lot of environmental and social determinants of health that intersect. There is a large homelessness problem there, and it is the fentanyl capital of the United States. Like, more fentanyl is bought and sold in that park than anywhere else in our country. And there's also a lot of issues with littering, and there's just a lot of opportunity for what we can do to work together to improve the situation in MacArthur Park, as well as the surrounding Westlake neighborhood. And so this event is going to be bilingual in English and Spanish with live translation. And we're going to have educational workshops. We're also going to have breakout sessions where really that's where our community members are going to decide how they want this money to be used. And we will also be giving away $10 gift cards to 30 participants. So if you are in Los Angeles and you're able to make it, I encourage you to RSVP, and here is the link, and here are the flyers as well with the QR code. And if you'd also like to share this with anyone, our email is going to be in one of the later slides, and I'm always happy to share this information. So another project that is in the works is through the All of Us research program. So we did an analysis on public transportation and non-communicable diseases, specifically looking at pain, fatigue, and quality of life, and how that relates to public transit access. And then we also looked at health disparities in public transit access by race, ethnicity, and socioeconomic status. So we submitted an abstract recently on this to the APHA annual conference, and our manuscript is currently undergoing edits for us to submit for peer review. And so the other exciting thing that we are debuting is the chapter system. So we are starting a chapter at USC, and we are looking to expand it to other areas of LA and outside of LA, across really, anywhere. And so the foundations of the chapter system will be community engagement, which is our ARCH Scholars program and our community climate adaptation program, education, and so we already have materials for workshops, also things like writing reports, op-eds, commentaries, and kind of, as we showed with education, posting materials in multiple languages on social media. And then for research, analyzing the data from the events that we do, as well as publishing to the larger literature for peer review. And then finally, we could not do this work without fundraising. And with the CCAP program and our extreme heat supply kits, for example, this is how we're able to provide supplies for our workshops, for our programs, and is incredibly important. And so in terms of the requirements, they're pretty simple. So first, just communication and meetings with the exec team, which is mainly going to be me and Arthur. And so this will be more frequent when starting up the chapter, and at a minimum for all of the chapters, we would want to meet once in the fall, spring, and summer. And there's going to be an expectation around timely communication, because that is the foundation of how we are able to do all of our work. And then with that, and having at least one activity each in community engagement, education, and fundraising in the fall, spring, and summer. And one thing I'm really excited for is to have collaborations among chapters, which is something that I have done in the past with other organizations. And so it'd be really wonderful to have trainings like across schools and across different community organizations, as well as working together on events. So here are some next steps that you can take right now. So we have our Linktree here. It's linktr.ee/ARCH_collaborative. And we have all of the regular social media accounts: YouTube, Instagram, TikTok, X, and Facebook. And so you can connect with us on there. We do have a Blue Sky account as well, and I do recognize the desire to transition to that. We just are very much a volunteer-run organization, and so there isn't really anything on the Blue Sky account right now, but that can change in the future, and I hope that it will. You can also join our mailing list for updates, and so that is also on the Linktree. And if you are interested in starting a chapter, or if you wanted to share information about the upcoming roundtable, I encourage you to email our office email, which is right here. And as always, thank you to our amazing volunteers, our partners, and the community members who make this work possible. So yeah, thanks everyone.